Good morning, everyone. Welcome back. The FDA approves a groundbreaking skin cancer treatment and a new regime to rival the popular Mediterranean diet. Just some of the headlines we're taking a look at in today's Health Roundup. Let's bring in Dr. Tom Pitts. Doc, welcome back. We love having you on the show. Good morning.
Anna, thanks for having me. I'm excited about some of the topics today.
There's a lot to get through today. Okay, let's start with the FDA just approving a breakthrough for skin cancer. This is huge. Tell us more.
Not just skin cancer, melanoma, which is the most aggressive and hard to treat and potentially fatal skin cancer. I'll mention that this is specifically for people that have melanoma that cannot be resected or cut out, or that has metastasized. So it is for that group, but it's very promising in its results. And basically it's using your own immune system to kill the tumor from the inside.
When do you think it'll actually be used on patients, or is it still in clinical trials?
Interestingly, we've modeled immunovectors through things like viruses that we insert like a Trojan horse back in. We know that there's immune activity inside of cancer, but when the immune system comes to kill the tumor, it stops by a checkpoint because it says, wait, this is me, it's my own cells, don't kill it. So tumors that are susceptible to being manipulated at that level are susceptible to having our Trojan horse come in and kill the tumor from the inside.
I have to move on to a story coming out of Oregon. Someone reported that they contracted a case of the bubonic plague, maybe from their cat. What do we know here?
Yeah, definitely. It's actually called bubonic plague, is Yersinia pestis. And so essentially, you know, we get about 7 to 10 cases a year.
Really?
Usually out of the Southwest. Unlike the medieval times, we have great antibiotics, like we're talking azithromycin potentially. But, you know, if you don't get treated within 2 days, it can be very difficult to treat. So it starts off with a rash and fever and lymph node in the groin area. So if you see that in the groin area, spreading it by a cat to the axilla and the neck, and you've been exposed to pests, you got to be seen right away.
All right. And the CDC just released a report. This is really sad about people living alone linked to severe depression. Does this surprise you at all?
You know, it's interesting. The wording of it is so fascinating because really when we look at people that are living alone, it's 93% of us don't have these problems. But if you look in the fine print, it's who also lacks social support and emotional support. So if you have a great family life, you went to a great brunch and then you go home by yourself, you might be excited for that break because you have all these other friends waiting for you. But if you're alone, no one to call, you have a bad day, that's where we see problems develop right there.
All right. Always check up on your friends. This story is interesting to me. There's a new report from Reuters. It shows rising cases of children, teenagers, taking Wegovy. Of course, that's like Ozempic. It helps you lose weight. Your thoughts here?
Komodo did a study, unfortunately, showing that over 10% of kids studied over a long period of time, 20 years of notes. They looked at kids aged 12 to 17, and over 10% of these 20 million kids had a diagnosis of obesity. So Wegovy, you know, it's like a blood pressure medicine. If you're at risk for stroke because you're smoking, those medicines will help you stop having a stroke while you're making a modification. But people can't take Wegovy and expect them to be healthy. Weight loss and health are very different.
So true.
So yeah, it can be used as a tool, but if no lifestyle modifications are made, a lot of people gain the weight back.
Let's talk about the Atlantic diet, speaking of food. Tell me more.
I grew up on it. My mom's off the boat from Spain. So this is the Iberian diet. It's Portuguese and Spanish, essentially.
Yum.
So it's the Mediterranean diet's like cousin in a way. And basically they're both saying, hey, we want non-processed foods. We want non-frying techniques. We want veggies. We want beans. The Mediterranean diet, though, is a little stricter. It does not want red meat, maybe some poultry, but no red meat, and very little starch, whereas the Atlantic diet says, okay, pretty much the same, but you can have moderate, like, you know, let's say lamb or some red meat, hopefully leaner, and you can have some potatoes, usually stewed as a thickening agent. However, again, this should happen in conjunction with, right, healthy sleeping, cancer prevention, so it's all part of the larger picture.
This actually seems like a sustainable diet.
To me, its greatest efficacy is its gateway ability to get you the Mediterranean diet, because that's too drastic a change.
No meat.
This is a nice segue in.
Dr. Tom Pitts, we love talking to you, doctor. Always keeping us healthy here at NewsNation. Thank you so much.
Thanks for having me, Anna.
Thanks for watching. Go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.